with the Health Secretary and some senators backing the return of physical classes. Let's hear the take of an infectious disease specialist. Joining us tonight on The Final Word is Dr. Edsel Salvania. Doc, thank you so much for joining us on the program. You heard Duque and Galvez saying that we could start some form of face-to-face learning, particularly in the university or college level. Do you think this can be implemented starting in January 2021?
Yeah, good evening, Rico, and to all the viewers. I think that it's reasonable to think about pilots, especially as Dr. Duque said, in areas where there's very limited or very low transmission, about maybe 4 weeks after where you don't have any new cases or at least any clusters of cases. On the other hand, for higher education, as Secretary Galvez mentioned, as long as we can adhere to treatment protocols and make sure that people are safe, maybe not full-blown classes where you're doing daily classes, maybe once or twice a week as needed. So I think those things can be considered, and as long as there's a good plan, we may be able to try to do it slowly.
I think face-to-face classes for 1 to 2 days a week is very helpful, particularly for college, university, or high school students, because it is important that they still face their teachers at least on some kind of level, Doctor. If you're talking about 2 to 4 weeks of zero cases, then it is impossible to have it in the National Capital Region or Metro Manila.
Well, it depends on how you count it. I mean, if you're talking about by the city rather than by the region, it might be doable because we're seeing some cities with almost zero caseloads. So I think that that's even more incentive for people to do better, especially this Christmas season. We were talking about this as being kind of a stress test to the system. That's the reason why it's still GCQ, because we are concerned about the holidays. But if we can make it through Christmas without any surges, I think that will tell people that, I think we're ready. And so that we should think about maybe getting back to school because it's good for everyone's mental health. And also it's very important that kids get back to the classroom to learn.
You mentioned the right word there, Doctor, mental health. It's really important that these students really get out there and see their classmates and the teachers, because it's also impacting them when they're just at home and doing online schooling. What about, Doctor, the high school level, especially private institutions that have the infrastructure to handle selective face-to-face learning or blended learning?
Yeah, well, I think that those can be thought about. I would probably start with college and also in areas where there's very limited transmission and go with what we see from those. I mean, we have to be flexible. If it doesn't work, it doesn't work. Yeah, you have to shut it down. And that's what people must understand, is that all of this is new and we don't know how it will turn out. We have to do this cautiously, and if there's something wrong, if there's a surge, then we have to cut back. But that's the reason why you want to do it in small stages, because if you do it in a big stage and something goes wrong, then it's much, much harder to control.
But what if schools, let's say in Metro Manila or in the Visayas and Mindanao, have the capacity to implement, Doctor, maybe rapid antibody or antigen testing for students? Could this be a strategy?
Right. So for testing in general, I mean, we're hearing about people who got on a plane with a negative RT-PCR, and when they arrive, they actually test positive. So the tests are not going to mitigate every single COVID-positive person. The more important thing is to make sure that everybody adheres to the mitigating measures so that even if somebody gets through, nobody gets sick. But again, that's easier said than done. We can have all the plans in the world, but what you really have to do is have some real-world experience, and that's where the pilots come in, because then you can see, where are the problems in the system, and then you can fix it or figure out if it's something you can work with.
Hopefully, we will start these pilot face-to-face learning initiatives in January of 2021, Doctor. But you know what, Doctor, Metro Manila is still under GCQ. But whenever I travel from home to the office, it's already traffic on EDSA. And on weekends, there are just so many people in malls. It doesn't look like there are any restrictions nor social distancing. Is this an indication that we are ready for mass gatherings?
Well, no, that's actually quite concerning that people aren't able to physical distance. What the IAT has been doing is actually, even though it's GCQ, they've been increasing the capacities of businesses to operate, just to get the to get the economy going. But this is also gradual. We have to keep an eye on this, and there's a lot of pandemic fatigue. So if people are careless, we're going to get shut down again. So I hope that everybody understands that this liberty that we're having now is something that can only be sustained if everybody cooperates. Otherwise, we're going to get locked down all over again, and nobody wants that.
And briefly, Dr. Salvania, what is your advice for our kababayans on how to stay safe and healthy during this holiday season while we are waiting for that all-important vaccine?
Yeah, I think that the most important thing now is for people to be very, very careful. It can't be business as usual. Konti na lang. The vaccines are coming. It can take months, it can take a year, but there is an end in sight. And so we have to be patient because we need to maintain or lower the number of cases we have right now, because if it surges, we're back to square one again. And it's really a shame because you know how the soldier who died 1 hour before World War II ended, you don't want to be one of those late casualties because there is an end in sight, and this is not the time to relax. This is the time to hold on and make sure that we make it across the finish line.
We must remain vigilant because we continue to face an unseen enemy. Thank you so much for joining us on the program, infectious disease specialist Dr. Edsel Salvania.